Hey guys, parents, moms, dads, babies. I'm on my daily walk to get my little ones from school. And as I'm walking, I wanted to discuss breastfeeding and breast milk again. Again, like I said before, breastfeeding is every 2 to 3 hours. And usually it's normal for the babies to want to be awake at night. Get the baby used to a pattern of waking up during the day a little more frequent. So even if the baby is sleeping during the day, wake the baby up. You don't want to skip any feedings, especially during the day, because they will make up for it at night. And then you'll suffer. Lack of sleep sucks. But also, let's talk about pumping. If you're pumping, it's good in the refrigerator for 7 days. So if you're pumping, label it, date it, time it, put it in the back of the refrigerator. In a deep freezer, it's actually good for 6 months. Again, label it and date it as you store them. If you're going back to work, ladies, and you want to make sure you have enough milk to store for your babies, what I used to do with my kids, and it always worked, was I would breastfeed the baby, then after I breastfeed, I'd pump for like 15 minutes to overstimulate my body to make extra so I can store that extra. And you'll actually make more breast milk. Now, sometimes times of stress, exhaustion can deplete the breast milk supply. If that happens, keep trying to feed as you normally are. Maybe feed a little extra, pump a little extra to overstimulate it. There's also some herbal supplements that you can buy over the counter or GNC that'll help increase your milk supply. They're safe for the baby. Many medications are safe to take when you're pregnant. You can go to the pharmacy if you're not sure, ask the pharmacist, or you can Google online and check the lactation risk. Okay, if you see an X risk, that's definitely do not take. But majority of meds are safe. Now, usually anything that you take and eat that may bother you or bother your stomach will actually maybe irritate the baby a little bit. So if you eat nice and spicy, irritating food, I love spicy food, by the way. Sometimes your baby may get a little gassy if it makes you gassy. Just an FYI for you to know. Now, like I said, breast milk is supply and demand. So the more you put the baby on, the more you'll make. You skip feedings, you'll make less. And as the baby gets a little older in age, as the days move on, the stomach will get a little bigger. Their stomach is roughly about the size of a penny. So the baby only needs, if you want to measure it exact, about 5 mLs every 2 to 3 hours. So don't get discouraged with the breastfeeding. If the baby is frustrated, crying a lot, you're frustrated, just leave the baby in a diaper, put the baby on your chest. Keep the baby awake and calm. Anyone awake will eventually get hungry and feed. Sometimes some people have problems. They have some things, inverted nipples. If your nipples are inverted, you can try pumping a little bit to pull them out. They also have breast shields. You can always use that. You can also ask Google lactation consultants. There are some lactation consultants that will go to your home and help you breastfeeding with your baby. Some nurses specialize in lactation. Some doctors in the clinic may push you to supplement feed, depending on the baby's weight, depending medically what's going on with the baby, you may have to. Mommies that are diabetic, even if it's just diabetes when you're pregnant, called gestational diabetes, expect for the baby to need heel sticks every 3 hours for usually the first 12 to 24 hours, because those babies can sometimes have low sugars. If the sugar level, the glucose level on the baby is a little low, they may advise you for medical indications to supplement, at least till the milk comes in. Sometimes if your baby's jaundiced, a little yellowing of the skin, which is not a severe medical problem, as long as the baby gets those special little blue lights. Sunlight is the best way to bring the baby's bilirubin levels. That's what makes the baby a little yellow. Down. When the baby's born, put the baby in the bassinet near an open window, not open window, closed window, shades open, so sun coming through. And let the sun touch on the baby. That'll also help. And hydration. So really keep on top of the feeds. Babies don't need water. Old school moms, grandmas will tell you, oh, baby needs water, baby needs water. They don't. If you drink water and you stay hydrated, the baby will get enough hydration from the breast milk. Also, if you formula feeding is every 3 to 4 hours. If it's a ready-to-feed bottle of formula, don't feed the baby from the same bottle. So if you snap a bottle open and the baby starts drinking from it, discard it when it's over, because bacteria from the mouth and the saliva will back up into the formula. You don't want to give the baby any tummy problems there. But if you open it and you separate it and you put it in the fridge, then you can reuse it. But I believe it's 1 day for the formula. I'm more of the breastfeeding person. But formula feeding is every 3 to 4 hours. Don't go longer than 4 hours with formula. And as the baby gets a little older, the feeding time may get stretched out a little longer. But your pediatrician will keep you up to date with that on feeding patterns. And as the baby gets a little older, their stools tend to change. The first couple days, usually even the first week, the baby's poo-poo will look very black, sticky, it's hard, very difficult to wipe off. As the baby starts digesting breast milk or formula, it usually gets a little seedy. Now, if the baby's constipated, you may need to increase your fluid intake if you're breastfeeding. If the baby's very constipated and irritable and their belly's distended, the baby may be having problems digesting. It's very rare you actually see that with breastfed babies, but formula-fed babies, it's actually more common. So if that's the case, a lot of parents have to change the formula. That's something you need to discuss with the pediatrician, or what brand to have the baby. Or if the baby is spitting up a lot. Sometimes the first couple days of life, the baby will spit up a little bit. And if they're spitting up with a little brownish, looks like old blood, it's normal. It's probably some stuff the baby swallowed. But if you're concerned, bring it up to the doctor just to make sure it's nothing serious. Usually, if the baby's irritable, after you've tried feeding, burping, changing, the baby's still irritable, try to do a temp. 100.4 temperature Fahrenheit would be a reason to seek medical advice, especially if the baby's under 6 weeks old before the first vaccination sets. If you like my channel, please subscribe below. Thanks. Bye.